Welcome to the NerdSQ YouTube channel. Today we are going to discuss some important model questions for especially coming Navodaya Vidyalaya Samiti and DSSB AIMS ESIC video number 29. This PDF material I already sent to PDF group. If you want the PDF material, you can contact me. Okay. First question: a patient in your ward develops a generalized tonic-clonic seizure. The appropriate immediate action you take is options: restrain the patient arms and legs to prevent injury, insert a spoon in his mouth to prevent tongue bite, turn the client on the side, pinch the client hands to stop seizure. So you can see all these four options. You can immediately select one option, that is turn the client on the side. So patients, maybe saliva or some food particles may come out to the mouth of the patient. So what will happen? Turn the client on the side. First we have to stay calm. So anyway, it will going to stop within few minutes or few seconds. So we should be very calm. Remain with the patient. That is important. Remain with the patient and turn him on the side. If the patient is on table, you have to put the side rails. You have to put side rails both sides, and you have to stay with the patient. To drain out saliva, you have to turn the patient one side. That is to drain out saliva and also prevent the tongue biting and tongue blocking the airway. Maybe blocking the airway sometimes. So at that time, if needed, you can prepare the medications like anti-epileptic medication you can prepare. So first you have to do, that is turn the client on the side. One of the primary functions of a circulatory nurse in the operation theatre is to options: verify the informed consent has been taken, prepare the surgical sterile table and instruments, assist the surgeon during surgery, set up the laryngoscope and other instruments for the surgeon. So what is the primary functions? Circulating nurse. That nurse, what his role, his or her role? So she has to circulate outside the sterile area. That means he cannot enter the sterile area, but he can stay outside the sterile area, and he can. First function, what is that? In this option, verify the informed consent has been taken. So informed consent edutittundennu verify cheyyuka. Verify the informed consent has been taken. That is the primary function of the nurse. And also charting input output chart cheyidittundo, mark cheyidittundo. So all these things from the ward, patients came to the operation theatre. She has to check everything and she has to inform to the ward if there is any misspelling mistake or something is there. If there is not there, proper charting is not there, she has to inform. Initial assessment of the client, so she has to check whether the client is safe, like that. Helping the surgical staff, preparing the instruments. For example, you can see the gauze pieces, it will comes inside a like paper. Inside a paper, that paper is not sterile, but inside that sterile gauze pieces are there. So she can take the paper out and she can transfer that sterile to the sterile nurse. Counting the instruments, outside instruments she has to count. She has to count and make sure nothing left inside patient surgical site. That is second checking. First, the surgical sterile nurse has to check, and second, she has to check. Next question. An assessment specific to safe administration of IV mannitol is options: vital signs 4th hourly, weighing daily, urine output hourly, level of consciousness 4th hourly. So an assessment specific to safe administration of mannitol is urine output hourly. So mannitol kodukumbo first the assessment the nurse has to do, check the urine output hourly, because mannitol is a osmotic diuretic. So it will increase the urination. Mannitol increase the urine flow by 61%. This medicine used in people with kidney failure to remove excess water and toxins from the body. So after head injury, previously osmotic diuretic usually give to remove the swelling from the brain. It will reduce the swelling and pressure inside the eye or around the brain. So that is the action. Nowadays, Dexona also giving. Next question, nursing profession can only be practiced after options: approval, licensure, valuation, accreditation. So nursing profession can only be practiced after licensure. License ഉണ്ടെങ്കിലേ നമുക്ക് വർക്ക് ചെയ്യാൻ പറ്റുള്ളൂ, പ്രാക്ടീസ് ചെയ്യാൻ പറ്റുള്ളൂ. Licensure after the degree or diploma. So we completed our degree or diploma, only we can work. Concerned state nursing council registration also needed. Nursing council registration needed, and after getting registration number should be there. Only we can work. So all these are previous questions. Next question, which safety measures will you take for a drowsy patient? Options: keep the side rails up, keep the light on, keep unnecessary furniture away, keep extra linen at the bedside. So all these options are correct, but first measure, keep the side rails up. That is the immediate priority. For example, after an ECT, patient came in a drowsy stage. So you have to keep the side rails up. Patient after endoscopy or ECT, like that. Keep the side rails up. Patient may be disoriented. Ensure safety and prevent injuries. Keep side rails up. Next question, which of the following is a significant component of pain assessment? Options: cause, effect, causing factor, intensity. Which of the following is a significant component of pain assessment? Correct answer, intensity. Intensity means തീവ്രത. Other components of pain assessing are location of pain. So ചില ലൊക്കേഷനിൽ പെയിൻ ഉണ്ടെങ്കിൽ അത് കുറച്ചും കൂടെ സീരിയസ്. അതായത് എക്സാമ്പിൾ പറയുകയാണെങ്കിൽ ഫോർ മയോകാർഡിയൽ ഇൻഫാക്ഷൻ there will be central chest pain and also the pain radiating to the left shoulder and the left hand. So after assessing that area, pain in that area, you can make sure whether it is MI pain or angina pain. Quality of pain, that means sharp pain, shooting, burning pain. Appendicitis, there may be shooting pain. Onset and duration of pain. Then aggravating and relieving factors. Numerical pain rating scales used in hospital. You know that 1 to 10 number will be there. 1 there will be very less pain and 10 very worst pain, like that. This example, you can see the example. Pain scale here: no pain, mild pain, moderate pain, severe pain, up to 4 moderate pain, 4 to 6 severe pain, 10 there will be worst pain. And also we can see some questions in this question paper. First question, 3 weeks after transplant a client develops leukopenia. The nurse understand that the leukopenia probably is caused by. So 3 ആഴ്ച after transplantation, 3 weeks after transplantation, patient develops leukopenia. Leukopenia means decreased WBC count. The nurse understand that the leukopenia, the WBC count decreased, that is caused by the correct answer, anti-rejection medication. So after transplantation, kidney transplantation or liver transplantation, anything after transplantation, doctor will prescribe anti-rejection medication. Example: prednisone, prednisone, prednisone. Then cyclosporin, Prograf, Prograf, prednisone, cyclosporin, Prograf. These all are the anti-rejection medication. what this medication will do? This medication will suppress body's natural immune system. This anti-rejection medication suppress body's natural immune system. So after transplantation എന്താണ് സംഭവിക്കുന്നത്? Our own immune system find out there is a foreign body in our system. So our own immune system attack that kidney or liver coming from another client. So this anti-rejection medication reduce our body's immune system, so that the patient usually advised after transplantation, usually the doctor advises the patient do not go out without mask or something like that. So there may be chance of easily affecting infection. So the patient may have anti-rejection, kidney rejection patient signs may have serum creatinine level will be increased, fever 100 Fahrenheit, chills, headache, nausea, vomiting, all these symptoms can develop. അപ്പം ഈ ഒരു ആന്റി റിജക്ഷൻ മെഡിക്കേഷൻ നമ്മൾ കൊടുക്കാറുണ്ട് സാധാരണ മറ്റൊരു കിഡ്നി അല്ലെങ്കിൽ ലിവർ വേറൊരാളുടെ ആയിരിക്കും. അപ്പൊ അതൊരു ഫോറിൻ ബോഡി ആയിട്ട് നമ്മുടെ ബോഡിയിൽ വർക്ക് ചെയ്യും. അപ്പൊ നമ്മുടെ തന്നെ ഇമ്മ്യൂൺ സിസ്റ്റം അവയെ അറ്റാക്ക് ചെയ്യാനുള്ള സാധ്യത ഉള്ളതുകൊണ്ടാണ് ഈ ഒരു മെഡിക്കേഷൻസ് കൊടുക്കുന്നത്. അപ്പോൾ WBC കൗണ്ട് കുറയും, സെറം ക്രിയാറ്റിൻ കൂടും, ഫീവർ വരുന്നു, ചിൽസ്, ഹെഡേക്ക്, നോസിയ, വോമിറ്റിംഗ്, ഇതെല്ലാം കിഡ്നി റിജക്ഷന്റെ സൈൻസ് ആണ്. നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, വിച്ച് ഓഫ് ദ ഫോളോവിംഗ് സിംറ്റംസ് ഈസ് മോസ്റ്റ് കോമൺലി അസോസിയേറ്റഡ് വിത്ത് ലെഫ്റ്റ് സൈഡഡ് ഹാർട്ട് ഫെയിലിയർ? ലെഫ്റ്റ് സൈഡഡ് ഹാർട്ട് ഫെയിലിയറിൽ കാണപ്പെടുന്ന മോസ്റ്റ് അസോസിയേറ്റഡ് സിംറ്റം ക്രാക്കിൾസ് ആണ്. ക്രാക്കിൾസ് that means small airway obstructed with the fluid. Small airway obstructed with the fluid. We can see the crackle sound. Left side heart failure ലാണ് usually കാണുന്നത്. And also weight gain, swelling, shortness of breath when lying down. ഇതൊക്കെ left side heart failure കാണുന്നതാണ്. Next question, when performing external chest compression on an adult during CPR, the rescuer should depress the sternum 1 and up to 2 inches. So adult CPR sternum should press 1.5 to 2 inches. So up to 2 inches you can press. Child up to 2 inches, infant up to 1.5 inches. Infant 1 to 1.5 inches. 100 compression per minute. Okay, 30:2. That is the ratio, 30:2. Next question, which post-procedure intervention should the nurse implement in a client after ERCP? ERCP means endoscopic retrograde cholangiopancreatography. Endoscopic retrograde cholangiopancreatography. So which post-procedure intervention? Correct answer, increase the fluid intake, because before ERCP the patient will be definitely nil per oral NPO for up to 6 hours minimum 6 hours. So we should infuse the IV fluid after ERCP, so that is increase the fluid intake. So the ERCP is usually doing to find out any diseases in liver, gallbladder, bile ducts, pancreas. So that's it. We can continue the class next video tomorrow. Thank you. All the best. Please share this video.